discussions on this very important presentation by our next speaker, who is Dr. N.K. Manjunath. Dr. N.K. Manjunath is the Director of Research and International Affairs in S. Vyasa University. It is one of the largest yoga university in the world, and now also has um, a branch office in California. And he has 25 years of research experience and specializes on psychophysiology of yoga and also on the neurocorrelates of meditation. And we can expect to get his expert views on what Dr. Sushil alluded to regarding meditation being kind of more safe for these sort of weak patients. Although I'm really wanting to know whether the composite Ashtang Yoga with asana, prana, and meditation built in, whether we should, keep one arm out just because the patient is weak. So we will have his views. And most important introduction, Dr. N.K. Manjunath, is that he's a proponent of integrative healthcare, integrative medicine. So we'll have his views on that. And he's also trained in naturopathy. So that's a good collection and assembly of skill groups, skill sets into this person who's almost like an institution, walking institution. Dr. Manjunath, welcome to this program, and the viewers and me and our panel look forward to your thoughts and your presentation. I think you have to unmute yourself.
Thank you very much. Namaste to everyone. It's my privilege to be on this panel. Thanks to Dr. Akshay Anand for inviting me to this program to share a few thoughts and few words about whatever evidence which can help us to understand the importance of yoga in post-COVID management. And it's once again a privilege to be with such great personality present here today as panelists, neurophysiologists, neurologists, cardiologists, and they are multidisciplinary, doing into multiple other activities and bringing medicine into integration platform. Dr. Raju has set the platform, set the tone right for all of us to talk about the post-COVID management and the importance of yoga in post-COVID management. So I was just looking at are there any standards already which have been placed? Like Dr. Akshay was talking about some guidelines coming from Ayush Ministry, talking about the role of different systems of medicine like Ayurveda, Yoga, Naturopathy, Unani, Siddha, and homeopathy, along with Sawaringpa, how they can be beneficial at this stage. And parallelly, when I was looking at other guidelines, if at all available for rehabilitation, it's very interesting to note that a lot of work is already going on in this direction. The World Health Organization itself has recommended or brought in some basic guidelines for bringing rehabilitation process in COVID management. In addition to that, what was interesting was the interim guidelines on rehabilitation, which has been prepared by the International Task Force, comprising of the American Thoracic Society and European Respiratory Society, bringing the importance of a multidisciplinary approach in post-COVID management. There are various aspects which have been picked for this designing this post-COVID management rehabilitation program. The interesting thing was it is said very clearly that the rehab process should start right in the hospital. So when a patient is even at a critical care unit, so what kind of activity should be started right in the beginning when the patient is in the hospital, and to give a direction for the patient as he moves out of the hospital. So the phases are something like this, what has been prescribed here. One is when an individual is in the hospital. Second one is post-hospitalization phase, which is for 6 to 8 weeks. That's very crucial when we talk about post-COVID rehabilitation, because whatever many things have been described by Professor Raju as well as Sushilji, that whatever we have been seeing, still lots to learn with respect to COVID. Already reported medical issues or complications, or whatever observations made have been related to various either systems or related to various functions. So here, 6 to 8 weeks have been given lots of importance. If early in rehab, we always talk about early intervention is the best. So that's why probably the importance has been given to right from the hospitalization phase to post-hospitalization phase. And the third is the after 6 to 8 weeks, the long-term rehabilitation phase. So the third thing is actually getting more prominence because more and more people are entering into that phase now. So we have lots of people in this 6 to 8 weeks phase, and there are a good number of them are getting converted into long-term rehab phase. Along with this, what is very important for us in rehabilitation structuring is we look at once the individual is out of the hospital, there are set of physical rehabilitation activities which has to be done. So we always bring in what has been put together as COVID related physical rehabilitation. So that includes pulmonary rehabilitation, that includes musculoskeletal rehabilitation, that includes systemic rehabilitation, whatever Dr. Sushil was talking about. So this is where probably we need to pick those important practices of yoga as wonderfully put under different stages by Dr. Sushil ji, that we need to really use certain techniques at certain places. Number one, to get the best benefit out of yoga rather than introducing any further issues or complications. So when we look at the respiratory system per se, that's the primary focus for everybody. So certainly yoga has a big role to play in pulmonary rehabilitation in this phase of post-hospitalization. Techniques which have been very well worked out for years now and being tried during post-COVID phase are as simple as simple movement, along with movement, whatever breathing exercises what you can give. So this helps in two ways. One is number one, makes the pulmonary or respiratory endurance increase. And second thing, this also helps us to give that extra stretch and extra exercise needed basically to make an individual do their respiratory activity better. So be it the intercostal muscles or a range of other areas which are involved in respiration. Second thing is definitely reversing the airway restriction. So this can be due to several reasons, and even what is being spoken is sometime can be somewhere affected even because of heavy medication or medication used in multiple combinations. So pranayama is one thing which has been spoken, but starting with simple breathing exercises, slow inhalation, slow exhalation. You can start with 2:2 ratios, 2 counts of inhalation, 2 counts of exhalation, make it 3:3, 4:4, and gradually make the exhalation phase longer than inhalation phase. This is what has been one of the standard prescriptions given for pranayama, which can help these individuals train their respiratory system. Additional thing at this phase, what has been spoken is introducing very transient phases of breath holding. So the transient phase of breath holding has been shown to actually help in improving the respiratory endurance on one side. And second thing, It probably helps in lots of draining process wherever if there is excessive accumulation of the um, whatever secretes which are there still in the respiratory system. So one of the cardiologists who was positive who turned positive treating COVID patients, this was the prescription given by him in UK, and he actually did a lot of research on this to say that when you do this, the even for example, he wanted to clear up a lot of things from his lungs, and he was able to do it much better. And the third thing is, if we really want to look at introducing using breathing as a tool to influence other systems. So we know that there is a direct influence on the cardiovascular system, then it has an influence on the nervous system, and there is a backward integration of its influence on your endocrine immune system, as Dr. Raju was mentioning. So we can have this whole circuit working as per our requirement if we can introduce slow breathing in the form of pranayama and then use this alternate nostril breathing as one of the super tonics. Okay, so a lot of research has been done on alternate nostril breathing, anulom vilom pranayama, and it's been found to be wonderful. The after if you really look at the issues related to hospitalization and this, another important area has been picked up for rehab is those who have been intubated. So there are individuals who stay in the phase of intubation, and resulting issues of how long you are on intubation also need to be corrected or probably attended. It can be related to as simple as voice culture. It can be related to your digestive and other retraining. So these are some of the areas which have been spoken in rehabilitation prescriptions for specifically for individuals who are on long-term intubation. And the third thing which has been given a lot of importance is psychological upliftment. So there is no need to talk anything about the psychosomatics part of it. And Dr. Raju has illustrated, and Dr. Sushilji has spoken about it. But yoga, if you want to really talk about it, that's the direct impact what we can look at. And what we want to talk about is bring this Adhi working on the Vyadhi. Okay, so the disease which is really getting affected because of your extreme stress and anxiety, which is actually hampering your recovery process. So the experts were talking about inflammatory markers, range of immune measures getting compromised. All these things can be probably very well reversed if we can start igniting this psychoneuro endocrine and psychoneuroimmunology or axis. And the fourth important area, which is which Dr. Raju and Dr. Akshay have touched, is the post-traumatic stress. Post-traumatic stress is one side to the patient, which we need to really work. And second thing I want to bring to the attention is the post-traumatic stress of the families. What has been faced is definitely important to attend as a part of this rehabilitation process. Many individuals have lost their dear ones. Amazing amount of stress they have gone through. They were not able to even see the bodies. They were not able to even attend the funerals. And this was a very serious thing. Throughout their life, they are going to remember. So this is totally, of course, I'm bringing an area out of the COVID individuals who are suffered from COVID. Second related thing is, I was just watching a TV show recently where Dr. Vikram Patel from Harvard University, who heads the global health and population wing, was really giving an amazing, really alarming figure of probable increase in serious number of individuals suffering from serious depression and leading to suicidal tendencies. So probably this is another area which we need to really look at. One, COVID, post-COVID patients. Number two, the scenario what COVID has created. We are talking about post-COVID. So many people have lost their jobs. So many people have lost everything what they have acquired in the last all these many years. So probably there is mind management which has to be done very well at this stage, attending to these various psychosocial aspects of COVID influence on all of us. Last but not the least is possible reinfection. So I come from Bangalore, and Bangalore and Karnataka have a few odd distinctions. Number one, Karnataka is the place the first COVID death was reported in Gulbarga. The first ever COVID reinfection was also recorded in Bangalore. So we truly don't know the processes involved in it. So it's high time for us to fix this whole process of reinfection, possibilities of getting individuals reinfected, and helping the whole community. Because if this becomes a little more prominent, the fear and the psychological unrest can be very. I mean, it will be very difficult to manage if people start having this fear. So with this, I end for now, and will be very happy to take up other questions frequently. Thank you very much.
Thank you, Dr. Manjunath. Thank you very much. I think this message has to go right at the time the patients are being discharged, because patients are the ambassadors with relation to your psychosocial effects when they go home and they practice meditation, yoga, and also send out a positive message to the community of what their experience was. For the viewers, just also for Dr. Manjunath, a small clarification. That particular circular of the Government of India came not from the Ministry of Ayush, but actually from the Ministry of Health itself. So that's actually quite a development, quite an improvement of, or sort of advocacy for integral and structuring of the rehabilitation.